As I discussed, is in the operating dental office, the first one is the school dental nurse. The school dental nurse is the person who is permitted to diagnose the dental disease and to plan out and carry out certain specified preventive and treatment measures, including some operating procedures in the treatment of the dental caries and periodontal disease in the defined groups of people, usually school children. It was first done in 1905 in New Zealand. Treatment for children was particularly difficult because of the distance and they are separated in the small communities. In the World War I, where there is a shortage of dentists, the dental nurse scheme has developed in Wellington in 1921 at the time of the World War. T.A. Hunter, the founder of the New Zealand Dental Association, pioneered in the establishment of the first school for them as the Dominion Training for Dental Nurses. The training period is usually 2 years for both reversible and irreversible procedures. Upon completion of the course, the school dental nurse is assigned to a school which was employed by the government for the dental care of 450 to 700 school children. If more than 100 school children per school are there, a dental clinic is present in that school. And a school dental nurse is treated as the member of the staff and he or she provide treatment at nearly 6-month interval. And the functions of the dental nurse are oral examination, prophylaxis, topical fluoride applications, advice on dietary fluoride, administration of local anesthetic, cavity preparation, and placement of amalgam filling in primary and permanent teeth. And also, she does the pulp capping, extraction of the primary teeth, individual patient instruction in toothbrushing and oral hygiene, classroom and patient and parent-teacher dental health education, and also referral to the patient to the private practitioners for the complex services such as extraction of the permanent teeth, restoration of the fractured permanent incisors, and orthodontic treatment. The second one in the operating dental auxiliaries is the dental therapist. It is been the dental therapist permitted to carry out the prescription of the supervising dentist, that is, sustaining the preventive and the treatment measures, including the preparation of the cavities and restoration of the teeth. The training is done for 2 years, that is both the reversible and the irreversible procedures. The clinical caries diagnosis, technique of cavity preparation, material handling and restorative skills, vital pulpotomies under rubber dam in deciduous teeth and extraction of the deciduous teeth under local anesthesia, and also little training in interpretation of X-rays was given to the dental therapist. And the third one in the operating dental auxiliaries is a dental hygienist. He or she is an operating auxiliary licensed and registered to a practice of dental hygiene under the laws of appropriate state, province, state or territory or nation. Work under the supervision of the dentist and licensed must satisfy the following qualifications like complete of education in approved education institution, demonstration of competency, and also demonstration of the satisfactory personality qualities. What are the functions the dental hygienist will do? Cleaning of mouths and teeth with particular attention to calculus and stains, topical application of fluorides, sealants, and other prophylactic solutions, screening or preliminary examination of the patients as individuals or in groups such as school children or industrial employees so that they may be referred to the dentist for treatment, and also instructions of oral hygiene are the functions that will be done by the dental hygienist. And the last one is the expanded functions of the dental auxiliaries. The name itself denotes it is the expanded function auxiliary, also known as expanded function dental assistant, dental hygienist, functional auxiliary, technotherapist, or duty dental auxiliary. They are the dental assistant or a dental hygienist in some cases who had received further training in duties related to the direct treatment of the patient, those still working under the direct supervision of the dentist. They can undertake reversible procedures which could be either corrected or redone without undue harm to the patient's health. Duties of the dental assistant in expanded functions are placing and removing rubber dams, placing and removing of temporary restorations, matrix bands, condensing and carving of amalgam restorations in the previously prepared tooth surfaces, and placing of the acrylic restorations in previously prepared teeth, applying of the final finish and polish or to the previously listed restorations that was done by the dentist. Development of training with the duties of expanded functions of dental auxiliaries in Canadian province of Ontario in 1970, an example to attempt to build a logical career structure of the assistants and dental assistants and hygienists was done. There are 4 levels of training and qualifications that are being recognized as certified dental assistant, preventive dental assistant, dental hygienist with expanded duties. Certified dental assistant. The training course is about 8 months duration. The assistant was taught regarding the traditional chairside duties. The only intraoral duty was exposing to the radiographs. And the dental hygienist is a student had to be certified or a preventive dental assistant. A 8-month training program was followed using carrying out of scaling, conducting the preliminary examination in the oral cavity including taking of case history, a periodontal examination and recording clinical findings, and also provide complete prophylaxis including scaling, root planing and polishing of fillings, apply and remove of the periodontal packs and apply fissure sealants. Dental hygienist with expanded duties. Training was about 4 months duration was given to the dental hygienist who had at least 1 year practical experience. They are allowed to carry out removal of sutures, placing, finishing and polishing restorations of amalgam and resin, placing and removing of matrix bands, cavity liners, retracting the gingiva for impression taking, fitting and removing of orthodontic bands, separating the teeth prior to the banding by the dentist, cementing temporary crowns previously fitted by the dentist. What are frontal auxiliaries? In developed countries where the dentist might stay in the urban centers, nurses and formal dental assistants go to the distant areas. They are provided with minimum training like doing the dental prophylaxis, dental health education, dental first aid, fluoride rinse programs, simple denture repairs. In 1981, an example of the frontal auxiliaries is a 1-week training was conducted in Alaska, and the formal dental assistants or the nurses were sent about more than 40 to 50 miles from the dentist so that they can do the service to the people. As I said, there are newer types of auxiliaries. They are dental licentiate and dental aid. One is dental licentiate. He is a semi-independent operator trained for 2 years to perform the dental prophylaxis, cavity preparation and filling of the primary and permanent teeth, extraction under local anesthesia, drainage of dental abscess, treatment of most prevalent diseases of the supporting tissues of the teeth, and early recognition of more serious dental conditions can be done by the dental licentiate. What is dental aid? This type of auxiliary personnel performs duties which include elementary first aid procedures, that is relief of pain, including extraction of the teeth under local anesthesia, control of hemorrhage, recognition of the dental diseases, which is important enough to justify the transportation of the patient to a center where proper dental care is available. These are the functions of the non-operating and the operating dental auxiliaries. Coming to conclusion. As if you know that India is the 7th largest country which has been in the world, a population of around 130 million has been increased in India. The need of an hour to develop the effective dental care delivery system which is equally distributed with a qualified and dedicated workforce is needed to do the treatments for the entire population of India. So there is a requirement of the workforce of the dental auxiliaries within India itself. So we should conclude that there is no workforce at the training of the dental or the dental colleges. Thank you.